Hello, this is Dr. Aaron LeBauer from LeBauer Physical Therapy, and today what I'm going to do is show you a balance assessment and a strategy to help get on and off the floor, or if you see someone fall, how to help them get up and down off the floor, or at least get up off the floor if they fall. Falls are something that no one really wants to prevent. No one wants to admit that they have fallen before. My name is Dr. Aaron LeBauer. I'm a doctor of physical therapy. I'm a massage therapist, a yoga teacher, former semi-professional cyclist, and I work with thousands of physical therapy business owners as well to help them grow their business. Over the last 25 years, I've worked with thousands of patients, helping them regain their balance, their ability to get on the ground, their ability to run, walk, play, and even just live life the way that they thought it was meant to be lived, rather than how they were told it should be lived. So most people are told that your body is fragile, that you need to protect yourself, etc. And we walk around a little bit in fear, but also if we've fallen before, we're much more likely to fall again. I used to race bikes and would fall a lot, 3 times a year. However, last year, I actually fell a couple times, once indoor wave surfing, and once when I was sick and got a concussion both times. It's not great. We don't want to fall again. I am likely to fall. So what am I working on? I'm working on my balance, stability, and strength. There's lots of different reasons you may fall. One was an activity I chose to do. The other one was I was sick and it was something out of my control. As we get older, we lose strength and mobility, and sometimes we have neurological changes with diseases, with eyesight, with sickness, but we do not have to lose strength and mobility. And we can stay stronger as we age. It's not just because you get old. And if you're over the age of 70 and you fall and you break a hip, which is your pelvis or even the upper part of your femur or your leg bone, if you break something and you have surgery, there is, within 5 years, 70% of people who fall and break something are no longer with us and they die. Within a year, it's something like 40% of people. It's a massive number. And the reason isn't because the actual fall, it's because the fall puts you in bed. You no longer are able to be active. A lot of times as you're older, maybe you get pneumonia, you get other sickness, and you die from some secondary cause, but the statistics don't really lie, and they're not great. So no one wants to prevent falls, no one wants to prevent injury, but really if you want to live a long, happy, and fruitful life, we need to work on your balance, your mobility, and your strength. And if you've fallen before, you need to work on it. So I'm going to show you a quick self-assessment to know, is my balance good? And then I'm going to show you how to get up and down off the floor, especially if you're concerned about getting on the floor because you can't get up. The number one reason a lot of people fall is hesitancy. They're hesitant and they're scared because I know I can't get up. Because remember the clapper, right? It's like, help, grandma's fallen, she can't get up. We don't want to be like that. No one wants to feel like that. So the first thing you're going to do is you're going to stand with your feet hip width apart, and you're going to pick up one leg and stand here. And if you're having trouble just doing this, then you are at risk for falling. You should be able to stand here for 10 seconds without trying super hard, and do it with your eyes closed. So we're going to try the other side for 10 seconds. And if you feel like you need to grab and hold something, or you're unable to even get here, this is a reason that you need to be seen by a physical therapist to assess why you're having trouble balancing. Not only do we do rehab after surgery and injury, we help people with their balance and mobility and their strength. So you should be able to stand here on one leg, eyes closed. So I'm going to do eyes closed. So that idea is get your balance, close your eyes. It's not easy for me either, especially talking. That means you have good balance. If you're unable to even do it eyes closed, then we should probably chat. So I'm not going to do it the whole 10 seconds. But you see, like, it's not great. I'm a little distracted, but I had 2 concussions last year and that affected my balance. The next thing is how do I improve my balance? Well, we can take a chair, and you can work on slight bend in your knee and standing here, and you can practice the test. Practicing the test isn't always the best thing to do, but you can do this for 10 seconds. And you want to have a soft gaze and look in front of you. And if you can't do it without holding on, that's okay. You just hold on. And you're working on your strength, stability, and your breathing. There could be a lot of other things that we might need, but when you're walking and running, we're always on one leg. Also, if you're trying to play golf and you can't balance on your left leg, you're going to be unable to shift there. I had a patient came in and he's hitting golf balls like this because he can't bear weight, not because it hurt, but because his brain was telling him that's not safe because he doesn't have the balance there. So, number one most important thing to do for your mobility, your strength, and your ability to prevent falls is to be able to get on and off the ground. As humans, as Westerners, we start on the ground, we learn how to crawl and gain core stability, and we stand and walk, and we never get on the ground again. We sit in chairs, we sit on couches. So we need to get on the ground. That's why I love burpees. A burpee is put your stomach on the ground and you stand up and you clear the ground. You do a little jump. That's a burpee. So the first thing we're going to do is work on getting on the ground. So if you can get on the ground like this, great. If you're hesitant to be like, Dr. LeBauer, I couldn't possibly do that, that's what this video is for you, or for you to help guide someone you know or love. How do they get on the ground or really off the ground if they fall? What we can do is we can take a chair. Let's see, we'll take a chair like this, and you're going to use the chair as something sturdy to balance. Step your leg back as far as you can, lower down to your knee, lower to your other knee, hands on the ground, and then hips. I mean, ideally we'll be here, and we can do some yoga. Work on balance this way, just one leg at a time. If you're struggling with balance, one of the things that we're going to want to do here is get you on the ground so we can take your, like your ankle and feet will no longer be a component of the balance if we're on your hands and knees. We have to be able to get you here. So now that we're on the ground, let's say we're laying here. Best thing to do, use your knees, bend them to roll to the side, press with your arms up, and come onto your knees. And this may take a lot of work for some people. Now we're here. Okay, how do I get up? I don't have the strength or balance because I haven't been doing this for a while. You can crawl to a chair, grab your chair like this, step 1 foot forward, and use the chair, lean forward, stand up. And let's say someone falls at a dinner party, at an event, out in public. The last thing you want to do is yank them up by the arms. First thing is make sure they're okay, they're conscious, because we don't know why they fell. They could have passed out, maybe they have a heart attack, maybe they have a stroke, maybe they just fell because they have bad balance, or their balance isn't where it should be. Then we can guide them through doing that, which is roll on your side. Hold on to something sturdy, a chair, a stool. Step 1 foot forward, 1 foot forward, and then you step up. And this allows your hips and your knees to be in the best position to produce the most strength. Now, I was teaching this at a workshop yesterday, and a lot of people were saying, hey, I had a knee replacement. Well, if your knees can't bend because of a knee replacement, they should be able to. It's just you haven't done it, or maybe therapy wasn't complete and we didn't get full range of motion. The other thing was, it hurts to be on my knees because I have had a knee replacement. And that is, it's okay, it's not going to damage your knees to be on your knees. You haven't desensitized the skin and the tissue that was cut open as part of the surgery, and it's not doing any damage. It just doesn't feel the same, and that needs to be worked on. So if that's an issue, or you're unable to bend your knees, that's another reason that you might be prone to falling, but you should also see a physical therapist to address some of these issues. Now, I can't cover everything about balance and falls in this one video. What I want to make sure is, here's a simple self-assessment to know if I'm having issues. So if you can't stand on one leg for 10 seconds, eyes open, you should go see a physical therapist. If you're unable to do that with your 10 seconds with your eyes closed, there's a balance issue. You probably see us too. If you're hesitant to get on the floor or you've fallen in the past, then getting a screen or a total body diagnostic from a physical therapist to let you know exactly what's going on is one of the best and easiest ways to get a plan for how to prevent this in the future, because the last thing we want is for you to fall, break a hip, end up in a long-term care facility and never leave. That is one of the last things we want, but most people don't see that as a possibility. It's totally fine, but the statistics show that that is a high probability of happening. I'm not here to scare you. I'm here to just give you the reality is if you're older and especially over 70, you should probably be exercising, lifting heavy weights, and working on your mobility and your balance training, and doing that with someone who can incorporate all your other medical conditions, medications, and issues to help you create a plan. And the best person, in my opinion, to do that is a physical therapist who understands balance, falls, exercise, mobility, hands-on treatment, and is able to guide you through this process, even if you're working with a trainer or in a group class somewhere else. So if you live in Greensboro and you'd like an assessment and a total body diagnostic exam, which is a 20-minute visit in our office where we take you through a full body movement screen to see what's moving well, what's not, what your risk factors are, and create a plan for you to get stronger, healthier, and more mobile, then you can always give us a call. And we never start with a visit here. We always start with a phone call first to make sure that we can help, because if we can't help you, we want to save you the time and effort and find the right place for you. So you can always go to LeBauerPT.com and fill out one of the forms there, or call us at 336-271-6677. You can call or text that number. Some of the details will be below this video. And if you just can't find us, just put LeBauer Physical Therapy in Google. You'll get our information. We'd love to help you. Or if you have someone in your family or someone you know and love who needs some help, please don't hesitate to reach out or create a three-way introduction with us. Please comment below. Let me know what was most helpful, what other questions you have, and I'll see you on one of the next videos. Thank you so much.